Disinfectants, Liquids 101, presented by Terry Lauren, WisCon consultant. Definitions: antibiotics, chemotherapy which destroy microorganisms within the body. Antiseptics, chemicals which destroy microorganisms on living tissue. Contact time or wet time, the amount of time a disinfectant needs to stay wet on a surface in order to be effective. Disinfectant, a chemical substance or compound used to inactivate or destroy microorganisms on inert surfaces. Sanitizer, substance that simultaneously cleans and disinfects. Sterilization, an extreme physical or chemical process that kills all types of life. Disinfectant categories. Sterilant, a chemical agent which is used to sterilize. Low-level disinfectant, a disinfectant that rapidly kills most vegetative bacteria as well as medium-sized lipid-containing viruses when used according to labeling. Intermediate level disinfectant, a disinfectant that kills all microbial pathogens except bacterial endospores when used as recommended by the manufacturer. High-level disinfectant, a disinfectant that kills all microbial pathogens including endospores. Instrument grade, a disinfectant that is used to reprocess reusable therapeutic devices. Hospital grade, suitable for general purpose disinfection of building and fitting surfaces for treatment of a disease, or are carried out involving the penetration of human skin. Household or commercial grade, suitable for general purpose disinfection of building or fitting surfaces, and for other purposes in premises or involving procedures other than those specified for a hospital-grade disinfectant. How disinfectants work. Disinfectants work by destroying the cell wall of microbes or interfering with their metabolism. It is also a form of decontamination and can be defined as the process where physical or chemical methods are used to reduce the amount of pathogenic microorganisms on a surface. Bacterial endospores are most resistant to disinfectants, but some fungi, viruses, and bacteria also have resistance. Disinfectants are most often very chemically reactive, which is how they work, and they can lose its potency quickly. Contact time is necessary for all disinfectants and vary with the target organism. Types of disinfectants. Alcohols. Alcohols are most effective when combined with distilled water to facilitate diffusion through the cell membrane. A mixture of 70% ethanol or isopropanol diluted in water is the most effective. Aldehydes. Aldehydes such as formaldehyde and glutaraldehyde have wide microbicidal activity and are sporicidal and fungicidal. Phenolics. Phenolics are active ingredients in some household disinfectants. They are also found in some mouthwashes and disinfectant soaps and hand washes. It can be toxic and is considered a carcinogen. Oxidizing agents. The most common is hydrogen peroxide, which is used in hospitals to disinfect surfaces, and it is used in solution alone or in combination with other chemicals as high-level disinfectant. Types of disinfectants continued. Peroxy and peroxo acids. Peroxocarboxylic acid and inorganic peroxo acids are strong oxidants and extremely effective disinfectants. One of the most common is peracetic acid. Quaternary ammonium compounds. Quaternary ammonium compounds, quats, such as benzalkonium chloride are a large group of related compounds. They are mostly non-reactive with surfaces, but is considered a low-level disinfectant. Terpenes. Thymol can be used as a medical disinfectant and a general-purpose disinfectant. Types of disinfectants continued. Inorganic compounds. Chlorine. This group comprises aqueous solutions of chlorine, hypochlorite, bleach, or hypochlorous acid. Iodine can be used on skin like betadine and on surfaces. Acids and bases. Very good for commercial grade like phosphoric acid and sodium hydroxide. Metals. Aluminum acetate, Burroughs solution, silver, zinc oxide. Others. The polymer polyaminopropyl biguanide is specifically bactericidal at very low concentrations. The polymer strands are incorporated into the bacterial cell wall, which disrupts the membrane and reduces its permeability. How to disinfect a contaminated situation. Determine what you are going to clean up. Limit access to areas so others are not exposed to contaminant. Find the proper disinfectant and contact time for the job. Use Canadian microbiological SDS sheets and EPA disinfectant guidance sheets. Use the proper glove for the job. Use glove compatibility information. PPE may be required, such as face shield, safety goggles, respirators, etc. Apply disinfectant and allow proper contact time. Clean up with disposable towels or use a mop for bigger jobs. Allow to dry, and when once complete, allow access. Sources of information on the Internet. EPA site. The EPA regulates disinfectants as pesticides. A list of disinfectants and contact times are listed. The next one is the Canadian SDS sheets. Canadian microorganism SDS sheets have good information on proper disinfectant to use on the respective organisms. The last one is a glove compatibility site. Here you have the right glove for the right chemical. The chemicals are listed as well as the gloves, and you can see if there's the right glove for that particular disinfectant.